Hey guys, welcome to my channel. My name is Don, and I'm doing a demonstration this morning on how to check your blood sugar levels in the privacy of your own home. I'm not a physician, so please check with your doctor. So guys, there's 3 times you could take this test. The first one is when you're fasting, which is preferably in the morning. You haven't had food for 12 to 16 hours. This is the time I recommend the most because the food has been in your system for quite a while now, and you're going to get the best representation, I believe, of how this food is genuinely affecting your blood sugar levels. When you take the test and you've been fasting, the healthy range would be between 80 and 100. If you want to take the test right after eating, the healthy range would be between 170 and 200. And if you take the test 2 to 3 hours after eating, the healthy range would be between 120 and 140. Guys, there's plenty of charts on the internet to show you how you're doing when you take the test. Something that's very important that I want to recommend to you guys is, number one, if you did a lot of exercise the day before, or you ate a food that you hardly ever eat, that would not be a good time to take the test. You want to have a fairly normal day. This is going to give you the best and most accurate numbers when you take the test. If you exercise a lot and you exercise the day before, that's fine. Just go through your normal routine. The other thing is, when you prick your finger to get the blood, you want to collect that sample within about 10 to 20 seconds. If you wait longer than that, if you start waiting like 30 to 40 seconds, that blood is now exposed to the air, and all the chemicals that are floating around, that can significantly affect the results, guys. I've taken the test before when I first started doing this, where I pricked my finger and I waited like about a minute, and the numbers were off the charts, way into diabetic territory. So I took the test again, and the numbers were in healthy ranges. I actually then took it a third time to confirm, and again the numbers were in healthy ranges. So what you're going to need, guys, to take this test is a meter. You're going to need test strips. You want a box of about 100, maybe 200, because you're going to go through these. You're going to need a lancing device, and you're going to need lancets. Again, a box of 1 or 200. They do not cost much, guys, and you're going to go through these. I'm going to show you the test strip, guys, because you want to always hold it in the middle, okay? Now, the smaller part on the bottom is the part that you actually collect your blood with, and the larger part is the one that goes into the meter when you go to collect your blood. But you want to have this out and ready before you take the test. So once you prick your finger, you're not having to waste those precious seconds to go find your test strip. You want it out. Have everything ready. Wash your hands thoroughly, guys, and rinse them off very well. I use warm water to promote some blood flow to the area, but you want to really make sure you get all the soap off, because any soap residue left on your fingertips, all the chemicals in that soap, can affect the test. So rinse them off really well, dry them off with a clean, dry towel, and make sure they are perfectly dry. And then you're ready to go. You haven't eaten in a while. You take your lancing device, you take the cover off. Now we take our lancet, which has a cover. You're going to take that cover off and keep that around, because once you're done, guys, that pin is exposed. This is one-time use only. Once you're done, you want to take the lancet out of the lancing device and put this cover back on. So when you throw it out, properly dispose of it. So if any animals eventually get to this, the cover is on the pin. Very important. So we're taking the cover off and we're saving it. There's the pin. Put it in the lancing device, push and twist. You heard that little click? Put the cover back on, pull this down, and you're ready to go. Tip of the finger, press down. You want to press the area to get some blood flow going, guys, but you don't want to touch the area where there's actually blood. You want to stay away from that. So now we're taking our test strip, holding it in the middle, putting it in, meter, the right side in there. There we go. And now we're going to collect our blood. And our number is 89. We're going to get paper towel on that, get a Band-Aid on that. Going to take the cover off. Like I told you guys, we're going to take the lancet out and we're going to put the pin back on so we can dispose of that properly. And now the lancet is empty and it's ready for next time. Now guys, 89 is about as good of a number that you're going to possibly get. In my next video, I'm going to talk to you about how I get that number between 80 and 100. If I wasn't eating properly and exercising properly, I would be at pre-diabetic levels, and by now I would probably be a diabetic. So watch for my next video on how to take charge of these numbers. This video helped you. I hope you will click on the like icon. Subscribe to my channel and send me your comments. And take this journey with me to a world of wisdom that could help you and your animals live a longer, healthier, better quality of life. God bless and be well.